I think we've learned a number of lessons from the SORCE study. Number one is that actually giving adjuvant treatment for renal cell carcinoma is more challenging in some respects than giving the same treatment in advanced disease. This is actually a generic problem for many adjuvant treatment studies where patients understandably feel they've had their surgery and that they should be free of disease and they really want to get on with their lives, and now they're burdened with extra treatment, particularly if that treatment has toxicities. And I think we've seen that in the SORCE study, although most of the toxicities were low grade, i.e. grade 1 or grade 2, actually only half of patients on the placebo arm completed the planned study treatment, only a third in the 1 year of sorafenib arm, and only a quarter in the 3 years of sorafenib arm. Now, admittedly, half the patients who didn't complete treatment did so because unfortunately they developed progressive disease and relapsed disease, but the rest of the people who didn't complete treatment had a variety of reasons, most of which were to do with not putting up with the treatment or the hassle involved in it. So I think we've got to minimize that. I think the other thing is adjuvant studies take a very long time, and we need to come up with a structure where we can ask a series of questions for this really vital question in renal cell carcinoma in an efficient way. And I'm really delighted that the infrastructure we've built in the SORCE study is now going to be used, or is being used already, in the next MRC adjuvant therapy study called RAMPART. The major toxicity of the SORCE study for patients was that they experienced a lot of skin toxicity. I think the fact that they would experience toxicity was predictable. I think the extent and the severity of the toxicity in this adjuvant patient group was an unpleasant surprise for the patients and for the investigators. So that 20% of patients in the trial therapeutic arms with sorafenib actually experienced grade 3 toxicity, and the majority of patients experienced grade 1 or 2 toxicity. But even that, grade 1 or 2 toxicity for a period of 1 or 3 years is very challenging for people to put up with. So RAMPART is a new study which has opened in the UK and will open more centres in the UK and France, Australia, Spain, and we hope the United States. And this is asking, there are initial questions it's asking are whether a PD-L1 inhibitor, durvalumab, or a combination of a CTLA-4 inhibitor, tremelimumab, plus durvalumab, are of benefit for patients who've had a high or intermediate risk renal cell carcinoma removed. I think the really beautiful thing about this is it's the same sort of design as the STAMPEDE study, where you can add and subtract arms depending on new data as they arise or new treatments that might be particularly beneficial for that patient group.